Good morning, everyone. Thank you for joining us. Today, we'll be discussing international telepathology as a means to improve pathology education and patient care at global sites. I'm Cristina Costales. I'm currently a medical microbiology fellow at Stanford University, and I recently completed my APCP training at USC. I also completed a year of Fogarty Global Health Research through Duke University, and my site was KCMC in Moshi, Tanzania, where I used postmortem diagnostics to determine cause of death in patients with fatal febrile illness in northern Tanzania. I will let Dr. Solans introduce himself as well. He'll be joining us for this discussion as well.
Thank you, Dr. Costales. My name is Enric Solans. I've been a pathologist for over 30 years. I work in a community hospital. I'm a general pathologist with a subspecialization in cytopathology.
So telepathology in a global setting. While I was at KCMC doing my research, I was lucky enough to be there while the ASCP was setting up a digital pathology system. KCMC is the third largest referral hospital in the country. It has about 600 beds, and it's a teaching hospital with medical, nursing, and lab scientist schools. Most recently, they opened a cancer care center, and never have pathology diagnoses been more important. There are two full-time pathologists who are locally trained, Dr. Mremi, Dr. Amsi. And so they are responsible for running the entire pathology department themselves. There's about 4 full-time lab scientists, and they see about 3,000 surgical cases a year and about 1,800 cytology specimens as well, as they do run a F&A clinic. There's a picture of me grossing in the gross room with our 2 laboratory scientists. So the benefits of telepathology is that it allows locally trained pathologists to interact and network and learn from experts around the world. Just at our site, we had access to pathologists at Duke, at UCSF, and a whole host of other universities as well. And so this line of communication allows for collaboration with research and, most importantly, education and training potential. And so here's a picture of Dr. Mremi, and he is actively using the telepathology system. The scanner is pictured there as well. And so we'll just quickly go through a demonstration of how the platform works. The Motic platform is available from any internet web browser, but optimized for Chrome. So we'll go ahead and log in now. And so this brings us to the site homepage. Normally I would go to the KCMC site, but for today we'll be using the Memorial Hospital site. And the front page allows you to see all of the cases that have been submitted for the month. And it also breaks down the number of cases by subspecialty. In the lower right corner, we can also see messages from consultants. The system allows you to communicate directly without having to use email to discuss cases. And so now we'll go to the case list. And so this will show us all of the pending and reported cases all in one list. So we can easily scroll through and find older cases and see what new cases have been reported, like this one up here. And you can just scroll over to see the different columns, which will show you the different subspecialties, the date of creation, and also thumbnails if you want to just quickly look at a slide image right there. You can actually export all of these cases into an Excel file, which is really, really helpful for organizing the general cases, to keep track of how many you've submitted and what's outstanding, as well as for research. You can create your own research folder and then track these through the export to Excel file. Okay, so let's go ahead and make a new case. So just click on the new button here. And so now I'm just going to enter a unique accession number. The system is set up like any LIS, really, with specific entries for different clinical information, including patient name, age, and gender, and then the specimen type, as well as the subspecialist or the subspecialty type. And so this is a real case from KCMC. This is a 47-year-old patient who came in with progressive difficulty in breathing as well as stridor. And so she was seen by ENT at KCMC. She was tested for HIV, which was negative. She did have a history of diabetes. And that's pretty much the only medical history we had for her, which was the case in a lot of patients at KCMC. We'll enter all this information here. Any surgical information is also helpful, not so much in this case, it's a biopsy, but for resections, any information from the surgeons was also available to upload. And then this is usually where we'd enter if the clinicians had any differential diagnosis, we would put it here. So in this case, we wanted to rule out a laryngeal carcinoma. And also extremely important, there's a space for entering your gross description. All of our grossing was done, no dictation software, so we wrote it out by hand in a paper-based system. So actually, as you see, the tab below or the button below allows you to select an image. So we can actually upload an image of the gross specimen itself. Or in my case, a lot of times I would just take an image of the handwritten gross description. So that would save a lot of time and really get the same point across. So in this case, we have like a 1.5 centimeter lesion, this polypoid, and serially sectioned, entirely submitted in a single cassette. And here I can go ahead and add a picture of the specimen. And then this can be viewed by the consultant. Next, there's room for IHCs if we did any on site, which at this point we had not. The primary diagnosis is a really important field. This is where we would have our local pathologist put their diagnosis or their differential diagnosis. And this is really helpful to guide the consultant to let them know what we're thinking. And if it's incorrect, they can always re-educate and really drill down on where we were making the incorrect assumption or incorrect interpretation of the tissue. And it also allows us to track the number of times that the local pathologist was different or rendered a different diagnosis than the subspecialist. And we can also add other PDFs if there was, for instance, like an op note, or if this was a research case, we could add a requisition form, whatever you need to add. And so next, we'll go ahead and upload the image. So this has already been scanned and is on our local server. The digital image of the digital whole slide image is available on the local server. And then we can go ahead and add our subspecialist, who in this case will be Dr. Solans. And so the ASCP actually allowed us to just upload our KCMC cases into a general folder. And so then the ASCP would actually identify the correct subspecialist to help us look at these cases. And so just going over quickly, make sure all your information is entered. And then we can go ahead and submit this case. And here at the bottom, and confirm that we're uploading it. And so now it will be transferred up into the Motic cloud. And as soon as the digital image is rendered, it will be available for Dr. Solans to see. There's also a widget that allows us to see the internet speed, which of course is a huge issue in international telepathology, making sure that your local site has sufficient internet bandwidth to upload these cases. And we spent a lot of energy making sure that we had this this internet connection working. And so, yeah. And so now that it's uploading, I will go ahead and hand it over to Dr. Solans.
So thank you, Dr. Costales. We have seen how easy it is to set up a case. So the next step is not complicated either. Once I get the notification that the case has been assigned for review, I open my browser, preferably Chrome, and will log into the Motic viewer. Now here, we'll go to cases and find my case right here. I just click on the case ID to open it. And on the left side, I see all the information that Dr. Costales had entered. The demographics. If we scroll down, pertinent clinical information, clinical diagnosis, the gross description, and as well a picture of the gross specimen. Scrolling down, whether any special stains have been performed. And then here, very importantly, the diagnosis of the local pathologist. Comments, attachments, in this case, surgical requisition, but any other attachments that the local pathologist had entered. At the bottom, I see the slides. In this case, there's one slide here, and the thumbnail. Clicking on the thumbnail, I will enter into the whole slide view. In here, I can select the area of interest by either moving the crosshairs to the area of interest or with my mouse. So for example, here, let's focus on the hypercellular area right here. So I just click in here and move the cursor. Scrolling my mouse, I can go into higher magnification. And the focus is automatic, very, very easy. Here I can appreciate the spindle cell pattern of the lesion. And if I go to a higher power, I can even appreciate the extravasated red blood cells. Using my mouse, I can go to different areas. Here on mitotic figure, you can clearly see. And if I want to jump to a complete different area, I'll just, again, click on the area and the viewer will automatically take me to that part of the slide. So after going through the slide, I can concur with the local pathologist with the interpretation of Kaposi sarcoma versus angiosarcoma. The differentiation between the two, it's important for treatment purposes. And in this case, ideally, I would obtain an HHVA immunostain, but immunohistochemistry is not always available or is very limited. In this case, due to the low-grade appearance of the lesion, but with the relatively high mitotic rate and the presence of the extravasated red blood cells, I would favor Kaposi sarcoma. Now, I want to bring your attention to this corner here, where you can see several options. Here I can capture a representative image. I can annotate or select an area of interest. If there is several slides, I can choose the relevant slides. And then here and here, it's different adjustments for the image, for example, contrast or color or whatever. In this case, here I will capture an image. This area, it's part representative of the lesion, so I will capture here. And I will enter a description of my capture. In this case, would be high power of a spindle cell lesion. Now we have captured the image. Now, I'll go back to the main screen. Let's focus now on the right side. Here at the top, there's a field in which I can order special stains. Again, this is not always available or is limited. Here I can see the image I just captured and the annotation I put next to it, the description here. Going further down, I can see the area for the interpretation or diagnosis. And here, there is a field in which I can message the pathologist. I can request additional sections, recuts, levels. Anyway, so let's go into the interpretation of diagnosis. In this case, I did concur with the local pathologist. So it's going to be Kaposis. Then I'm going to suggest the HHVA stain. Once I'm done entering the diagnosis, I click Preview. And this way I can see the way the final report is going to look. Now that is important because the local pathologist can print this PDF and the document can be directly added to the chart. So again, demographics, the information that Dr. Costales had entered. There were no immunohistochemical stains. The picture I capture with the annotation here.
This was a really, really helpful feature, especially for educational purposes. We didn't just have to rely on the text from the subspecialty pathologists. They could actually directly take pictures and show us exactly what they were talking about in their microscopy description. And so these PDF reports were actually printable. We could put them directly into the patient chart. So we could, bring them to tumor board and discuss directly with the clinicians what our expert pathologists were interpreting the tissue as.
So if I'm satisfied with that, will click OK. This patient was not treated by the oncologist. A few months later, however, she came back to the clinic with multiple skin lesions, which was consistent with disseminated Kaposis. One more thing here at the bottom.
On the lower right screen of every case, we were also able to see a timeline of exactly when the case was created, when it actually got uploaded, and then when our report was generated. And then if there was any messaging back and forth, that would also show up here. So it's just another feature to help us track when we were submitting things and like how long the turnaround time was for our reports, which was generally really fast. Our consultants were really great about getting back to us quickly. So in conclusion, we used this platform, really a back and forth communication tool that was really helpful. And hopefully we got some accurate and timely diagnoses to patients. All right, so that is all we have. We're going to hold a Q&A session next. So please submit any questions you have about the work of the ASCP and their global diagnostics program, or regarding the telepathology platform itself. Be happy to answer any questions.